Dental radiographic exams are one of the primary diagnostic tools to determine disease states and to formulate the appropriate treatment. Radiographs should be prescribed according to selection criteria guidelines. These guidelines are based on a variety of factors, including the patient's medical and dental history, clinical signs and symptoms of disease, risk factors, age and dentition, and new or recall status. Dental radiographs are valued diagnostic tools when the image quality is adequate enough for proper interpretation. To do this, it is imperative to correctly place the image receptor in the mouth and ensure that the primary X-ray beam is centered and aligned correctly in both the vertical and horizontal angulations. At this time, it is crucial to minimize patient exposure to radiation. Successful images require the use of careful technique and precautions to maximize their diagnostic and interpretive value. This video is provided by Dentsply Sirona and is to be used as a guide to enhance the clinician's skill in acquiring quality radiographs. This informational guide is not intended as a replacement for the Directions for Use manual for any product shown. Always check your manufacturer's guidelines for recommended use of equipment. The paralleling technique is used for both periapical and bitewing radiographs and is the most accurate technique for taking these projections. Receptor instruments with X-ray beam ring guides improve the accuracy of the PID alignment to ensure correct beam angulation and centering. Receptor instruments combine a receptor holder with an arm that has an attached ring indicating the position for the PID. This helps the operator avoid cone cut errors by specifically directing the X-ray beam toward the center of the receptor. RINN offers two unique phosphor imaging plate holders for periapical and bitewing images. The Flip-Ray PA phosphor imaging plate holder, which is indicated for use in positioning phosphor imaging plates for anterior and posterior radiographs, and the Flip-Ray Bitewing phosphor imaging plate holder, which is indicated for use for bitewing radiographs. Both holders accommodate size 0, 1, and 2 phosphor imaging plates and are autoclavable for proper sterilization in between usage. Phosphor imaging plates have an active side and an inactive side. The inactive side may have information displayed such as plate size, imaging type, and a reference point for position orientation. Always check the manufacturer's directions for use, or DFU, for the type of imaging plates you have before using. As demonstrated here, a bite protection plate is being used prior to placing the imaging plate into the disposable protective sleeve. Once the disposable protective sleeve has been sealed around the imaging plate, it can be carefully placed into the bite block for use. The Flip-Ray PA phosphor imaging plate holder is pink in color and has an adjustable ring and media holder which allows clinicians to easily flip orientations to change quadrants quick and efficiently. This single holder can be used for horizontal or posterior and vertical for anterior periapicals. After the imaging plate is loaded into the protective cover, it can then be placed into the bite block in a vertical position for anterior periapicals and a horizontal position for posterior periapicals. The clinician will flip the holder, moving from one quadrant to another, ensuring the bite block is centered within the aiming ring. Position the holder into the patient's mouth and slide the ring close to the patient's face. Align the tube to the ring and take the exposure. Bitewing radiographs are considered part of the routine dental assessment. It may be 5 to 7 years between full mouth sets, and bitewing x-rays are an important diagnostic tool to monitor disease and health during this time interval. To properly detect caries in periodontal disease, it is essential to capture open contacts between teeth and maxillary and mandibular bone levels. It is important to ensure that the central ray is perpendicular to the image receptor. The Flip-Ray Bitewing phosphor imaging plate holder is red in color, and this single holder will flip easily for clinicians to switch from a horizontal or a vertical bitewing image depending on the patient presentation. After the imaging plate is loaded into the protective cover, rotate the media holder to the desired horizontal or vertical position depending on the type of bitewing image needed. Ensure that the bite block with the image receptor is centered within the aiming ring. Position the holder in the patient's mouth and slide the ring close to the patient's face. Align the X-ray tube to the ring and take the exposure. Thank you for viewing this instructional educational video brought to you by Dentsply Sirona.